BDO family. My name is Jade Curtis. I am the executive editor here at blackdoctor.org, and I want to thank you all so much for joining us for this community conversation on navigating Medicare enrollment. This is a topic important for everyone 65 and older, or for those nearing that age. Medicare open enrollment time is right now. It started October 15th and runs through November 7th. Tonight, in partnership with Cedars-Sinai, we'll answer your questions about enrolling in Medicare. And so Cedars-Sinai Medicare Medical Center, located in Los Angeles, recently earned a 5-star hospital rating from the Centers for Medicare and Medicaid Services, also known as CMS, the highest distinction from this federal agency. This is the 7th straight time that Cedars-Sinai has been rated among the hospitals providing patients with the highest quality of care in the nation. So kudos to Cedars. We love to see a hospital doing what they need to do. With help from our expert panel, we will discuss why it's important to review your plan annually and what's new for Medicare in 2025. So let's go ahead and meet who is joining us this evening. I'll kick it off with Ms. Pamela Gentry. She is the Deputy Director of the Office of Minority Health for CMS at the Department of Health and Human Services. Ms. Pamela works to advance the agency's commitment to and investment in health equity for underserved populations, including policy and program innovation to advance health equity. How are you, Ms. Pamela?
Great.
Wonderful. So good to see you. Also joining us is Bruce Young. He is the Director of Managed Care and Payer Relations at Cedars-Sinai in Los Angeles. How are you, Bruce?
Doing great. Thanks for having me.
Of course. Also joining us is Dr. Mary Norman. She is a geriatrician with the Cedars-Sinai Seniors Advantage program. How are you, Dr. Mary?
Great. It's wonderful to be here.
Wonderful to have you. And last but not least, joining us is Nita Lane. She is joining us tonight. She is also a Medicare user and a Medicare Advantage insurance agent, as well as a former Cedars-Sinai patient. She also recently moved to Nevada and has plenty of experience to share with our viewers this evening. How are you, Ms. Nita?
I'm doing well. Thanks so much. It's good to see you all.
Good to see you too. So before we begin, please let us know where you're joining from. Drop it in the chat, whether you're in Atlanta like myself or in Los Angeles like some of our panelists here. Please let us know where you're tuning in from. And throughout the conversation, we'll be answering questions from you all. So if you have any questions about Medicare, Medicaid, anything from our panelists, please drop it in the chat and we will get to it throughout the show. So let's go ahead and get started. So to kick off our conversation, I will turn to Ms. Pamela Gentry from CMS to give us the highlights on what's new in Medicare for 2025, and then give us a quick introduction to Medicare for those who are new to the program.
Thanks for having me. It's my pleasure. It's the second year that I've joined you, and it's always a pleasure. There are quite a few new changes in Medicare every year, but they're always about important benefits. And those are all highlighted for you in the annual Medicare and You guidebook, and that is sent out every September and also is available online at medicare.gov. On page 2 of the guidebook, we always highlight what's new and important, so it's a great place to start. But here are a few things I'd like to highlight. First of all, because President Biden's new prescription drug law that was signed, it goes into effect in 2025, your yearly out-of-pocket drug costs will be capped for every individual at $2,000. So if you have Medicare drug coverage Part D and your drug costs are high enough to reach this cap, you won't pay any co-payments or co-insurance for Part D drugs for the rest of the calendar year. And that's starting in 2025. You'll also have the option of spreading your drug cost payments across like a monthly payment throughout the year, so it won't be so burdensome for people who do have expensive drugs. Medicare is also going to cover expanded mental health care and like intensive outpatient program services in certain locations and services for married family therapists and mental health counselors. So during your yearly wellness visit, which you will talk a little bit about later, your healthcare provider can also use a health risk assessment to better understand your social needs and refer you to appropriate services and support. And Medicare covers additional caregiver support. And that's really important because it's like training that helps caregivers give better care for you and relief when you're caring for family members, especially at times like in hospice care. And also some people living with dementia and their caregivers might not be able to support them throughout this. We have a new pilot program that's going to look at that and hopefully bridge the gap for those providing that care at end of life, particularly. And there are also updates to coverage for postal service employees and changes to their telehealth coverage that became very popular during COVID. And a lot of those benefits they wanted to keep. So again, if you check page 2 of your Medicare and You guidebook for 2025, you'll find more information on all of those benefits and a few more.
Fantastic. Thank you for sharing that with us. So for our viewers tonight who may be just shy of 65, when should they start thinking about enrolling in Medicare? When should they start that process?
Well, generally, most people enroll in Medicare when they turn 65, and this is called your initial enrollment period. And you have about 7 months, starting 3 months before you turn 65 and ending 3 months after. So that's your window of opportunity to enroll. Now, some people may be eligible for Medicare that aren't 65 due to a disability. But to enroll in Medicare, most people just need to contact the Social Security Department directly. I know that we run the program, but they're in charge of the enrollment. So it's recommended that you do this before your 65th birthday to avoid any lapse in coverage and to avoid any penalties for applying late. And you should receive a packet in the mail from Medicare before you turn 65. And you can enroll online or in person at Social Security office. Some of them do require an appointment, or simply by calling Social Security at 1-800-772-1213.
Gotcha. So they shouldn't wait until they're 65. They should already have the information that they need. And once they turn 65, go ahead and do that.
Yes, absolutely.
Beautiful, beautiful. So when people are signing up for Medicare, what exactly are they signing up for? Is it the same as any other insurance? Is it different? What are they signing up for?
Oh, I think there's a yes to that and a no to that, and we call it alphabet soup. We have an A, a B, a C, and a D. So we just get to the first 4 letters of the alphabet. But Part A and Part B are often referred to as Original Medicare. And this is a fee-for-service health plan operated by the federal government. Part C is called Medicare Advantage Plan or Medicare Health Plans. A lot of people coming out of the private sector are a little more familiar with the Medicare Advantage Plans because they can purchase these plans through private insurance companies approved by Medicare or their certified independent insurance agents. And what's most familiar to them is that you also have the options of getting prescription drug coverage, which is called Part D plan. And lastly, if you don't elect to purchase a Medicare Advantage plan, which is usually like an HMO, you can purchase a Medicare supplemental insurance, which is called Medigap. And what that just means is that it covers any expenses that Medicare doesn't cover and your private insurance doesn't cover. And so that's called a Medigap plan. But you cannot enroll in Medicare Advantage plans and a Medigap plan. You must be enrolled in A and B to sign up for Part C, or Part A and B to sign up for Part D. So basically, that simply means that you have to have one of the insurances. You either have to have Original Medicare or Medicare Advantage to continue down the alphabet and include drug coverage and other coverage.
Gotcha. Can you actually reiterate that one more time? Because you have to have one part of one thing to have another part. So you have to have.
Well, it's real. See, one is Part A and Part B. One is insurance, where you go to the doctor's office, and then Part B is where you go maybe to the hospital. It's the second code. So what it's just saying is that you have to commit it that you're going to be in Medicare, either through a fee-for-service plan or through a managed care plan before you can go and enroll into other parts of the alphabet. A Medigap plan, you can't have Medigap if you don't have the original, and you can't do the prescription drug if you don't have a managed care plan. So
There
it's
we go.
just they're just dependent upon each other. But they kind of make sense once you figure out exactly what your decisions are, what type of coverage you want.
Absolutely. Makes sense. Makes sense. And so
Okay.
you also touched on expenses, out-of-pocket expenses.
Mhm.
So how are Medicare premiums actually paid for? What is the process for that there?
Well, most enrollees do not pay a premium for Part A because they or their spouse paid into the system their entire working career for the required term via the FICA deduction on their paycheck. So I'm sure all of you've seen that, and if they haven't been paying attention to what that was for, it was for Medicare. And those who haven't met the requirement, they pay what's an adjusted monthly premium based on their employment history. So but a lot of folks don't end up having a premium payment for Part A. Part B premiums are typically deducted from enrollees' Social Security deposits. Or if you're one of those many eligible people who continue to work and you choose not to take your Social Security at the young age of 65, you can pay your premium via just a regular bill. And then the Part C, those were the Medicare Advantage plans that I was talking about. You may or may not, you may or may not be charged a premium based on your income and the benefits that are offered. So it's important to look at your options and meet with your licensed insurance broker to weigh each plan and the cost versus the benefits that are offered. And then Part D, if you're a higher income person, you may pay an additional monthly premium. But again, it's important to discuss your specific needs with a licensed insurance broker or a senior health insurance counselor to find a plan that works for the medications that you take on a regular basis. And financial help is always available. So for people who qualify, Medicare savings programs run by the states provide help for Part A and Part B premiums, and there's an extra help is available to help pay for Part D premiums. And we can put the link in the link in the chat for both of those Medicare savings programs and the Part D extra help. So there are ways to help supplement if you do find that you're in financial need.
Fantastic. And so we actually have some questions from the audience. So let's go ahead, and I'm gonna say this one from Gloria. Is it true that it is better to have original Medicare than to have a Medicare Advantage plan?
Well, it's not, I don't think that's not a good, I disagree with the premise, true or false. It depends on your choice. I mean, it's the type of choices you made often when you were working. Most of employers now only do offer managed care plans. So it's a level of comfort. Fee-for-service plans tend to often not require a lot of pre-authorization necessarily. And you can go in and they don't really have as strict of a network provider listing. So, it's what your preference is, and it's where you live, and it's what's available to you. But it's really a personal preference because a lot of people have always been in a managed care or a Medicare Advantage environment. All of their doctors are in those maybe in those plans. So I don't know that one is particularly preferable over the others because I do think it takes in a lot of factors.
Mhm. Absolutely. And it sounds to me like it's whatever's best for you. There is no better
Yeah.
best for everyone over.
Yeah, absolutely. It depends on the kind of things that you need and the kinds of medications that you take, and whether you maybe have a chronic or long-term illness and you want a specific doctor. And depending on the plans in your area, where your provider is available to you. So there's just so many personal choices. It would be hard for me to give a blanket answer for that.
Absolutely. And Tobin, I see your question as well. We're actually going to get to that a little bit later on the show. So if you can hold tight for just a little while, we'll get to that question. I don't want to jump the gun. So Pamela, back to you. We talked about our alphabet soup. So I want us to talk about the C and D parts. So where can people go to find trusted information about Medicare Advantage plans and prescription drug plans? As we can see some from our questions, we're hearing some things from our audience about what may or may not be true. So where can we go for real trusted information?
You can start with Medicare.gov. It will help you compare all the plans available in your area, and all Advantage plans are not the same. Some are HMOs, which require you to stay in a network, which I was mentioning earlier, and while others are like PPOs, and they allow you to see doctors in particular regions of the state. But Medicare has a plan comparison feature online where you can look at your options and even check if your prescription medications are covered. It's vital that during Medicare open enrollment, which started on the 15th, individuals review and compare their options to find the coverage that best meets their needs. Plans change from year to year, so we encourage everyone to shop and compare plans to be sure they selected the best one. And if you need more information, you should reach out to a licensed insurer professional or your state health insurance assistant program, which we affectionately call them SHIPs. And you can find the number for your state at shiphelp.org.
Wonderful, wonderful. Well, Pamela, thank you so much for answering so many questions right off the rip. I'll take some of the heat off of you and move over to Dr. Norman, let you drink some water, take a break. So let's talk about the Medicare Advantage plans. We've got the perfect person to speak tonight. And that's, as I've said, Dr. Mary Norman. Again, she is a geriatrician with the Cedars-Sinai Senior Advantage Program. So, Dr. Norman, can you tell us what are the kinds of services you are offering your patients in Los Angeles? And for our patients maybe not in the area, what kind of questions should people be asking when considering an Advantage plan?
Great. Thank you so much, Jade. Pleasure to be here tonight. So I'm very excited. This is my second year also joining this presentation and entering my second year with Cedars-Sinai in our new program, which really focused on offering the highest quality primary care for our patients. So it's all about the team. Number one, you have to have a physician who loves taking care of seniors, who is dedicated to that type of care and interested in that. And then you need a structure where you have more time. Many of our seniors need more time than our typical 15 or 20-minute visit. So having a structure where we have an hour for new patients and 40 minutes for routine follow-ups. I see patients as often as I need to. Some I see monthly. If you need to come back next week, I'm going to find a way to see you. So you're looking for that type of environment. It's also about the team. So it's not just me. I have dedicated medical assistants, a front office scheduler who helps not only check in and out, but also helps you make those specialist appointments, for instance. We have case managers. We meet twice weekly to go over complex patients to make sure we're meeting all their needs. I have a pharmacist who also works with me. So if people have that suitcase of meds and they're not sure what does what, then we bring the suitcase in and we go through one by one. And that's just a sampling of what we offer. We also have social workers that we work with. So it's about the team, and that's what you should be looking for. Now we have kind of a structure and a team that's all in place, but wherever you are, you want a doctor who's really focused on your care, has the time and the access to be able to see you when you need to be seen, and can coordinate care, that care coordination with other people. Also, I think is very important, and one of the things that I love about our program and Cedars is the network of specialists. So, who does your primary care doctor work with? Can they get on the phone or within our medical record, our Epic medical record? I can ask a question and coordinate care with 3 or 4 different specialists if I'm concerned about a patient, and that can be done in minutes. So, does your system of care that you're choosing, are you electing to be part of a group where you have that great coordination of care?
Absolutely. So it sounds like it takes a village.
It does take a village, yes.
Your team is what will, make you have the best experience. So absolutely, I love that. Thank you for that. And so, Bruce, you're also one of our guests from Cedars as well. And so you offer your Medicare Advantage patients free resources to get assistance with selecting a Medicare plan. Can you tell us more about that? Because, when people hear free, their ears are going to perk up every time. So
yeah, when you hear free, take right. Thanks. So having a licensed insurance professional is really on your side as your advocate is really key to this whole thing. What I've said to folks in the community is this: if you own a car, you most likely have a mechanic. If you own a home, you probably have a plumber, and you know these numbers or have access to these numbers, and the list goes on and on and on. And so when you're of Medicare age, you really need somebody on your side who will be a relationship with you that will help you over time. And so my first preference, which and insurance agents don't charge clients anything. By law, they're not allowed to. They're paid based on commissions, and the commissions are regulated, so there's no tipping between one product or insurance company or another. And so fairness is really what that's all about. And insurance agents really want to protect their relationship with you, just like a plumber or an electrician. They want to do a good job and they want you to call them back. So to have a good local agent is really the first and best line of defense. But when we're communicating with hundreds and thousands of people all at one time, just like we probably are on this live stream, we talk about our partnership with eHealth. So we have a partnership with an organization named eHealth, which is really just a large national insurance agency. And tonight we can offer that resource to everyone who's watching. So if you need help with selecting a Medicare plan in your area, you can go online. And I don't know if we have so it's across the banner in the bottom. You can go to just www.ehealth.com. And if you live in the Los Angeles area and you're interested in services at Cedars-Sinai, it's www.ehealth.com/Cedars-Sinai Medicare, all one word. Or you can call the 800 number on the bottom of the screen there. A great thing about eHealth's tool is that it will land you, if you use the Cedars-Sinai address, will land you on an eHealth page that just lists the benefit plans that Cedars-Sinai participates in. And then you can use that to compare. And you don't have to talk to anybody. You can always call the 800 number once you get to a point where you might need some assistance. Or you can just call the 800 number and start to talk to somebody right off the bat.
Okay, so a lot of different options to access that program. Love that. So you can either pick up the phone, or you can go on still pick up the phone and go on Google or on your laptop or whatever is your preference.
Right.
Love that. So Dr. Norman, back to you. So when people are selecting a plan, I think one of the things that they'll think about are, the providers that they get access to. And so if you are on Medicare, does that eliminate some of the doctors you can work with, or do all doctors accept Medicare?
Yeah, that's a good question. And I think most doctors do accept Medicare, but things are constantly changing. So it's very important to check with your doctors. If you have particular specialists and doctors that you really want to see, you need to be talking to them and making sure that they're going to be in your plan, whether you choose Medicare or whether you choose an HMO or PPO through Medicare Advantage.
Gotcha. So if someone were to choose a plan and they still want to see their favorite doctor, the favorite hospital, will they need to review their existing plan, or if they're happy with their benefits, are they just all set?
You should always review every year, because there is still a lot of movement. Doctors are changing their relationships, they're changing hospitals, they're changing affiliations. So it's very important, I think, each year to check with your doctor and key specialists.
Nice. And so I do understand correctly that people can only make changes once a year. Is that correct? Only once a year?
Is that for Pamela? Yes.
Is that for me? Yes. Well, open enrollment is once a year, but if you have an extending circumstance, like you change jobs or you move out of state or something happens, yes, you do have an opportunity to re-enroll. So yes is one of the answers. And then but there are a few exceptions. The other thing I wanted to run back to also to mention about Plan Compare is that on Medicare.gov there is a Find Plans Now section, and individuals can go there and do side-by-side comparisons of plans in their area. So that's another option for plan comparison as well.
Nice. And then you also talked a little bit about the exceptions, and I can either point this to Dr. Norman or Pamela, but what are some of the situations that can happen to make a change? You touched on them a little bit, but can we dive a little bit deeper into what those changes are? What are those exceptions to change your plan outside of that one time a year?
Well, there are really only two. There might be three. I'm trying to think off the top of my head if I can remember now. But the first one is if you move, for sure, or if your plan changes. We do have things that happen with plans sometimes, and so that would qualify you. And I'm trying to think. I'll have to look in my notes to see if I have the third reason. But the open enrollment is pretty much the primarily time for you to change your plan. I mean, I know I'm forgetting a third reason, but I'll think on it.
If you have,
You want me to dive in?
yeah, go ahead, Nita.
Oh, somebody dive in, right? There are the 3 times actually. You move, you actually enter a facility or
Right.
exit a facility, meaning a skilled nursing facility.
Mm-hmm.
And the other is, of course, you are out of the area, same city, but you've moved out of the area. So moving is not just from state to state or town to town. Sometimes you're no longer in the zip code or you're no longer in the area where you can get those services. So, and then there are other things, but I'd love to open up the Medicare and You book and just kind of tell people where the cheat sheets are. You know,
Yes.
if you've got a question, they've got the answer. It's just in the book.
Absolutely. And thank you for, that was the perfect time to jump in because I was just going to ask about your experiences, with you being a Medicare user, and you also happen to be a Medicare Advantage insurance agent and a former patient of Dr. Norman's, actually. So before moving, you recently moved to Arizona, correct?
Actually, no, it's Nevada.
That's what I thought. And so, yeah,
I
absolutely.
wish I had the pleasure of Dr. Norman as my doctor, but it was Dr. Chafin at Cedars. So I'm just honored actually to be here. You asked me about my Medicare experience.
Yep.
First off, when you have older brothers and sisters that have like 16, 15 years above you, they're going through the whole issue before me. So with that, you have a lot of people asking questions. Nita, you've been in insurance for a long time. What is that? Well, they didn't understand that I was in a certain area of insurance called directors and officers. So I kept getting these sort of kind of questions about the aging and medical insurance for those that are 65 and over. I don't know how long we have circulated each state's book, but the title just will not let you forget. This is about you when you've turned 65. Medicare and You. So
Can we see that? Sorry, can we see that from the side just so we can prove this has everything you need in there?
This has everything you
got a lot
need
of pages.
according to your state.
Absolutely.
So as
I'm so excited for this commercial. I can't wait to tell them what a great job you're doing.
thank you. As Ms. Gentry pointed out, the alphabet soup, the secret recipe, is absolutely on page 9. So if part A is a hospital bed, rather just a hospital, it's a bed, a little cartoon sometimes, just a hospital bed. If you've got a hospital bed, you want to see a doctor. Oh, so you need part B to see a doctor. You have part A. All of us have to pay into part B, everybody. Part D is prescription drugs. 2006, our president at the time, Bush, declared that all of us should have a prescription drug policy and we should pay into that system. So here we are with ABC again. You turn 65, but you're back to being 5, learning the ABCs in a new way. So that's how I got it. I kept it on a 3rd grade level and said, listen, reset, starting over. I got to know how to jump rope, jump through hoops, play on the playground. And that's what Medicare and You to me is. It's just a playground to know what's happening after you get 65 or after you've worked during past 65, you still have things to do. So it's very important that we really circulate this book and point out the cheat sheets.
Absolutely. That's a fun way to put it. It's your new playground. Your new playground.
Cool.
Yeah, and Nita, I actually want to pass on this question from one of our viewers about, being that you've moved from somewhere else to Nevada, right? And so they've stated that, I'll just read their question word for word.
Sure.
Is Nevada less helpful with Medicare? My friend who moved there from Seattle said he really gets hit with big copays and it's hard to get his tests approved for his prostate trouble. Please advise. Any thoughts?
All right. So the first part of that question, kind of read it again. He
Is
said,
Nevada less helpful with Medicare?
no. See how he talked about a state. How can a state be less helpful? No, not true. The state is the one that says, hey, listen, you can do business as an insurance company here. So we have to go with plan. And sometimes things need to be backed into what's your issue or what's your doctor. Are you willing to get a second opinion if your doctor is not in a network? I was going to call you Dr. Gentry, but as Pam said, you really need to know what your needs are, your priorities, your space. This thing is not a one size fit all, never has been, never will be. The insurance industry has always been individual lifestyle reflection, no matter what.
Absolutely.
So Nevada's not less helpful. What he needs is what Mr. Young talked about, a me, somebody who will absolutely hold your hand and walk you through the kindergarten ABC Medicare class.
Absolutely. And the way you put it, you may have some people wondering, okay, how can I work with her? Are you able to work with people across the nation, or is it just in the state that you're in? If someone is interested in working with you, can they work with you even if they're outside of Nevada?
The beauty of the insurance industry is technology. And all you need is a non-residence license to work at your desk at home in the state of Alaska and hit all 50 if you can afford every license.
Okay.
So I'm at the top of the world, even though I'm at the bottom in Nevada. But if I were in Alaska, I'd be on top of it, and I will help anybody, anywhere, because seniors have to relocate. They have children who say, you're not living alone. And before you get sick or debilitated, come move with me. So a whole bunch of folks I know have downsized. They've left California, including me, because somebody with some power, like a grown child, said, come on and move. So we have to know that there are agents that really will work with folks, and I can steer them, give them the information. Just like Bruce said, we do not charge, because what I want us to do, and I've always been this way, I want to win in the team that I've joined. And if I've joined the senior team, we're going to win. We're going to use every benefit. We're going to do everything we can to prolong this good life.
Absolutely. I love that. When they say, it reminds me of high school. I know I'm too whatever, but the seniors are usually on the varsity team, and that's the best team. So if you got the seniors on your team, you're with the varsity team, you're with the best team.
Jade, we are double senior, baby.
I know that's right.
Triple, some of us, okay?
Love that.
That's
Love
it.
that. So let's go ahead and get back on track. Thank you all for your questions. Audience members, I'm glad you guys are engaged. So Dr. Norman, once seniors like Nita get enrolled, one of the key benefits of being on Medicare is an annual wellness visit, which is different from a yearly physical. So can you tell us what happens at this visit and why it is important for the seniors to schedule one every year?
Yes, this is my very visit. So Medicare, I think something about 15 years ago, they came up with this idea of an annual wellness visit. Before, Medicare only paid you, you could only see the doctor and get paid if you had a problem. So it wasn't really focused on prevention. So the annual wellness visit, it is an opportunity to partner with your doctor to come up with your personal health plan. And I look at it as a time to kind of go head to toe through your goals that you're setting for yourself, whether that's to lose 10 pounds or it's to be able to walk down the aisle without a walker at your kid's wedding. Whatever it is, my goal at the annual wellness visit is to help you function at your very highest level. So we go head to toe. We talk about vision. Do you have cataracts? Do you need a referral to ophthalmology? Hearing. Do you need the wax out of your ears? Do you need to see the audiologist? Dental work. We look at things that affect your heart and your brain. So let's talk about your cardiac health. Do you know your numbers? Do you know your blood pressure, your cholesterol numbers? Are they where they're supposed to be, or do you think we need to tweak that a little bit? Let's talk about diet. We know diet, like our heart healthy diets and our Mediterranean diets, that help our brain. Spend some time talking about that. Function. How are we moving in space? This is a big one. We talk about people that are not leaving their homes because they've got sore
Right.
knees. So let's make sure we get those knees taken care of. Let's do physical therapy, know that we're doing the right type of exercises. Maybe we need to see the podiatrist or the orthopedic surgeon to get to have one of our joints looked at and fixed. And then let's look deeper at things that also affect our well-being, our mindfulness, brain health. Part of the annual wellness visit is assessing for any sort of cognitive loss or changes. Likewise, how's our mood? How's our sleep? I'm so glad to hear from Pam about the additional benefits we have now for mental health and also for people as caregivers with dementia. So a lot more advantages and benefits coming too. Got to look at that medicine bag again, because you'll hear that to me every time. So it is a wonderful chance to look through everything. Cancer prevention, your mammogram, your colonoscopies, are they up to date? And right now we have an awful lot of vaccines that help people prevent disease. So this is a chance to really talk with your doctor about the benefits of each of the vaccines that maybe you may be due for and offered. Lastly, my number one job as a doctor is to honor my patients and their wishes. This is a chance to look at those advanced care planning options and documents. Have you named a medical power of attorney? Have you told your loved ones what you would want or not want in cases of an emergency? So it's a lot to cover. It's a very exciting visit, and I love people to come in with their goals and to leave feeling really empowered with great things to accomplish over the next year.
Absolutely.
And if I might add on the wellness, I always say consider it a date. So you're going to date your doctor, you're going to inside out, not outside in, but now we're talking about every part that you've never even given a thought to, because now you're interested in prolonging your life. So if we use it as an introduction, use it as an interview, you're interviewing your doctor. This is somebody who's going to know you inside and out. So there you have it.
Oh, and the other thing, the annual wellness visit is free.
Yes,
So that's another good thing to know. It's one of the best bargains I think there is out there.
I agree.
Absolutely. And I hope everyone's geriatrician is coming with the same energy as Dr. Mary. I mean, I'm not going in for this exam anytime soon, but I'm excited for whoever's going to Dr. Mary, because it sounds fun. It sounds like you're going to go in and be taken care of. And get that deep dive that you need. So awesome. Thank you for sharing. So Bruce, another question for you. For someone who maybe is finding the process of picking a plan maybe a little complicated, should they use an insurance broker, and would they have to pay for those services?
So yes, use an insurance broker. No, you don't have to pay for services. So I know that it's very complex, and we've mentioned a couple of tools. So, it's always helpful to do as much homework as you possibly can, but you don't have to. And you have someone who could be an ally to you in a local insurance agent. And because I think one of the things that they would know best, that any of the other tools that we've talked about so far, don't know or don't have or don't provide is more local information or knowledge about provider networks. So one of the things that we either will or have hit on so far is your doctor a part of your plan? Is the doctor and hospital part of the network that serves your plan? These are important questions, and sometimes those things change based on contracts with insurance companies, and they can change any time of the year. And so that, along with changing benefits on these plans, are reasons to be in touch with your insurance agent throughout the year as needed, or during this time in particular. On the issue of payment, I would say that Nita, if she's visiting you in your home, or anybody like Nita, they would probably appreciate some iced tea and maybe some chocolate. These folks, particularly at this time of year, are very busy. So anything you can do to capture as much time as you can from them so that you can get all your questions answered and everything else, that tea, coffee, and cookies always go a long way. But no, there's no fee for their services. They're getting paid by the insurance companies, and they have a vested interest in maintaining and providing good service to you because they get paid residuals. So as you renew your coverage every year, they make a living off of that. And so so if you're looking for the financial incentive angle on this, it's really keeping you happy with their services.
Fantastic. So for those who maybe aren't looking for that person because they are still working, or are they still looking for that person? If you are 65 and working, continuing to work, do you have to take Medicare if you still choose to work? Pamela, can you answer that question?
So this is a scenario where you need to speak with your human resource department to find out, where you're employed and what their rules are for employer-based insurance plans. So sometimes your employer plan requires you to sign up for Medicare. So if you plan to continue working into your Medicare eligible years, it would be very important for you to know the rules of your employers and your specific situation. But you definitely can keep working. There's a lot of people are still not retiring at 65. So, but it will really depend on the companies or the organizations that they work for.
Nice, good to know. And being that it is currently enrollment season, it is a good time to go ask those questions if you are at 65 or nearing 65. And so I want to just open the floor and just talk about some of the reasons why people might want to change their plan for 2025. And I'll open it up to the group, whoever wants to jump in and start. But why would someone consider changing their plan in 2025?
I would say benefits change every year. So even the plan that you're on may not be as good as the plan that you could have. So costs are very important. Costs in this case, and coverage, are two things that are very, very important. So there are, and just like what you might think of as medical benefits, many Medicare Advantage plans come with additional things that Medicare itself might not normally cover, things like dental coverage. And so the amount of coverage, or whether or not the plan that you currently have offers next year the same level or any dental coverage, is just one prime example of, and these things might change by state too, or by region. It's always important to check back every year. So a good insurance agent will reach out to you either by mail or by phone or by email around this time of year each year to give you a benefits checkup. And they'll also want to know what's in that briefcase full of medication that you're taking, because formularies for Part D portions of these coverages also change, and that can really hit your pocketbook. Your health changes over the course of the year or a year, which also then changes the kinds of medications that you might take. So those are all very important things to check on every year. I think to our previous talking point here, our last topic is don't do nothing. You can do nothing, and you will just be grandfathered into next year's version of the plan that you have. But for instance, if you're if you're turning 65 and you still have employer provided coverage, you need to check with somebody. And so oftentimes I would err on the side of doing something rather than doing nothing. I don't know if any of the other panelists have any thoughts about any of the following items, but I can keep going if they'd like.
I would to just, underline the importance of what care you need, because your coverage, it's very individual, it's very individualized. So there is no one size fits all. I think someone mentioned that earlier. So if your prescription drugs, make sure that they're going to be covered. Make sure that the physicians that you like and love are still going to be in your networks. And I think the other thing that I would say is make sure that the benefits are the benefits that are that work for your health care. And I guess the last thing that I would, check off this list is that knowing which doctors are in your network. I think that's important. And a lot of times people don't realize until after they've selected a plan that their doctors are not in that particular plan.
Oh, yes, that's the worst.
And this is what I'll add, and it's always cartoonish in a way, because every year, if you were on a job, you had an annual review. Every year you either looked for a raise, or they may have reduced your work, or something would have happened, but we're very interested in that. Treat Medicare the same way, line by line. See if there's utilization on your side. Did you use everything, and why not? We have to always look at it on an annual basis. Not only does your health change or your plan change, but maybe you're now into acupuncture and you never used that benefit before. So now you're interested. I think we just need to use everything we can to keep your head up.
Absolutely. And I love that you actually brought up acupuncture. That was one of our questions from the audience. Do any parts of the original Medicare, cover acupuncture or counseling?
And that's why you would go with a plan. So it's almost like an auto industry. They got parts, but don't you need a plan, a map to go where you want to go? So the government gives you the parts, and the plan will give you those ancillary, or should we say added benefits. And the added benefits are the acupuncture or the chiropractic coverage, dental coverage. Sometimes it's embedded in the Advantage plan. So it's according to your need, as Ms. Gentry keeps saying, and definitely Bruce is saying. We have to see, what do you need? And I think we can come up with a plan that fits your needs for that year going forward.
Absolutely. And so as we're talking about, the needs that you need from your plan, what if someone decides that an Advantage plan isn't for them? Is it okay for them to just take the original Medicare parts A and B? And are there drawbacks to that?
Well, everything has date rules, everything. So you're just not going to jump in and jump out.
Right.
We're going to have to stay somewhere until the date comes, and then you can move. So when you can move from a Medicare Advantage plan, this season right here is really annual enrollment period, not open, because open enrollment period starts in January to March 31st. That's when you could say, listen, I don't really want to be in a network type of plan. I want to get out of the Advantage plan, and I'm just going to go back to the original Medicare, and I'm going to get a Part D to go with that. And that's all I'm going to do. And a lot of people don't realize that there are deductibles and co-pays out of the pocket that original Medicare will not cover. So you'll get a hospital bed, you'll get a doctor in the room, and you will get some medicine, but you will not have a gym. You will not be able to have any dental coverage. All of that stuff is separate.
Pamela, anything to add to that?
Original Medicare is original Medicare for some people, they're very comfortable with it. But again, the enticing things to the managed care plans are often that they can give you additional benefits, like and they've listed all of them, inclusive of, I think the only one I haven't heard is some of them actually also will include hearing aids. But I think the biggest difference between original and the Advantage plan sometimes may be the copays and the out of pocket. So people just need to be, again, aware and just make sure this is what works for them. But that's the key. It's very individualized, but there is something there for everyone.
True.
And sometimes in some areas, your physicians or your hospitals that you want to use are not in a Medicare Advantage plan. So that's another reason a lot of people would stick with original Medicare, so that they have freedom of choice to go to their favorite providers.
That's true.
Wonderful. So there are also a lot of supplemental and Medigap plans available. How does someone choose between either the two, or how do they decide which one is right for them? Bruce or Pamela, either one.
So supplemental or Medigap plans are kind of both the same animal. They're just two different names. Both of them are a name for a product that you would buy from an insurance company that goes with your traditional original Medicare coverage. And a lot of people, and they're expensive. And when you buy a Medigap or supplemental plan, you still should purchase another policy called the Part D plan, or PDP. It's a standalone pharmacy benefit that if you delay enrollment in that plan, a lot of people say, oh, I don't need to get into a Part D plan because I don't take any medication. That's a little bit like somebody saying, I don't need to buy life insurance because I'm not dead yet. So it's insurance for a reason. You're paying somebody for a benefit when it's needed. And so the structure of how Part D plans were developed were with that in mind. And you will have a penalty on your premium if you enroll late. So these are things to think about. They're costs that are related to having a Medigap plan and a Part D policy. What used to be a real big pull factor for people in their interest with supplemental and Medigap plans was just that they had maximum amounts of choice about which providers they would use. Some of the limitations that are more traditional about Medicare Advantage plans are beginning to go away a little bit. So on Medicare Advantage HMO products, for instance, you might be limited to having all of your full coverage with your benefits really only in your local area. And then if you go outside that area, you're only covered for emergencies. Well, so that would be one reason people traditionally would have said, well, I should have a supplemental or Medigap plan because I want to travel. There are some Medicare Advantage PPO plans that are now available that offer you national coverage that is beyond emergency coverage. And the benefits and the costs of those particular types of benefit plans are very, very competitive in comparison to supplemental or Medigap plans. Also, supplemental and Medigap plans beyond your initial enrollment period of 12 months are underwritten. And the first two things that go to your underwriting are your gender and your age. And the third thing is where you live and the overall costs associated with getting care, but then also your medical history. And they all have that information because of your claims from your providers. And so you could if you have a health condition that continues to worsen or as you get older, the folks that do the underwriting for these plans figure that you're going to get sicker and therefore your premiums will continue to go up. On Medicare Advantage plans, they're federally qualified and therefore don't have any of those underwriting concerns. So those are the trade-offs that you make on some of these things, where you might have more of a lock-in for a particular network of providers. But on things like Medicare Advantage PPOs, you can still have coverage for outside of that network versus just paying for the freedom to do whatever you want with a Medigap plan. I don't know, does that help answer the question, Jade?
Absolutely.
Okay, good.
Okay. Sorry, I thought I heard Pamela saying something, but maybe not.
I was just saying he covered it perfectly.
Oh,
yes.
Right. Good work. You guys are on fire tonight. So I'm taking it all in. All right. So before we move on, I think we should do a little bit of a recap. We have touched on a lot. So I want to make sure we're reiterating some of our really, really good information. So again, where can folks watching tonight go to find trusted information or help enroll in Medicare for the first time or selecting a plan during open enrollment? Bruce, I know you just spoke, but I remember you touching on a website and a phone number. So if you don't mind reiterating on some of those things, and any other panelists who care to chime in, please do.
So I don't want to take any wind out of Pamela's sails, but I would say Medicare.gov is the authority. And that's the best place to start because, as Nita had said earlier, it tells you everything. So that's a good place to start. The next place I would recommend is an agent. And either that's a local agent, ask your friends, or try to find, a good agent. They're like therapists. You might need to try more than one to find the right one over time. Or go to eHealth using the toll-free number that's going across your bottom of your screen, or ehealth.com, www. the letter E and the word health, all one word.com. And if you want to put Cedars-Sinai Medicare with a / after that eHealth, you can go to Cedars-Sinai plans. Those are really the best things to do to start. I'll just open up for everybody else.
I would also like to recommend that before they even head to the website, that they make a list of any health challenges they're having or things that they want to explore regarding their health, as well as medications that they're taking now. Looking at how their previous year has gone and their medical needs and their medical history, so that when they do sign on to somewhere like Medicare.gov and they start looking at what they need and all the coverage options, that they have that information in front of them so that they can really make informed choices. And especially if they're working with a broker, those are probably going to be some very, the types of questions they're going to ask. And their lifestyle, do they travel a lot, or are they going to stay in this area long-term or short-term, or, is this the year they're downsizing and thinking about moving? So I think all of those kinds of conversations in advance of looking for the plan is just as important. And then again, like I have to do my commercial on Medicare.gov, but also there's a place right on there you can search. It's called Find a Plan, and it will give you side-by-side comparisons of all of the things that I just mentioned. So that would be my plug.
All righty, and my last plug would be what? Medicare and You. And why? This is a state-issued book. So I'm in the state of Nevada, and in the book on page 122 to the end is every plan. That's, of course, an Advantage plan and a prescription drug plan has already been printed out. So it's not homework, at least it's getting the vocabulary. What am I looking for? What's happening? Who are the players? Who are the insurance carriers? Okay, now we can do some things. How much are the plans? So your Medicare and You book will save you from doing a whole lot of clicking.
Right.
All you got to do is turn a couple, 3 pages.
My last plug will be, after you narrow down your search, make sure your favorite doctor is still there and that your favorite hospital system is there and your specialist. So that's your last checkbox.
That's
so
it.
thank you all. It's been a wonderful evening.
It's been glorious. Thank you.
Thank you. Absolutely. Well, I want to thank you all so much for joining us. I have one last question. I know we got to all of our audience questions during the show, so we won't have to get to those, fortunately, because we already answered them. But I do want to learn really quickly one more thing about CMS that I just think our audience could really utilize. What should our viewers know, and what should they look forward to in terms of the Medicare system over the next 50 years, Pamela?
It's 50 years. Oh my goodness. And how many, what do we have, 30 seconds?
Maybe this was a shameless plug. I needed to know, so let me know.
No, I think the entire healthcare system is evolving. It's not just Medicare. It is true that we are one of the largest players in the area, but we learn a lot from our partners and our stakeholders, and the systems are improving every day and changing every day, and the needs are changing for all of our consumers for these programs. So I would say the next 50 years, we'll probably even see medical science doing even greater things and saving more lives. And I think that's what we all want.
Yes.
Wonderful, wonderful. Sorry, didn't mean to hold you that extra 30 seconds. I appreciate it. Well, again, I want to thank you all so much for joining us and for our partners from Cedars-Sinai for this informative discussion. Thank you to Ms. Pamela Gentry from CMS, from Dr. Mary Norman, and Bruce Young from Cedars-Sinai, and our Medicare user, Nita Lane, for sharing their experiences. I'm sure our users will remember to check their Medicare plan annually and to review that Medicare guidebook from all of the advice that you all have shared with us. And again, our audience members, for more information, visit medicare.gov to be sure you're getting the plan that is right for you. And again, if you are a patient of Cedars-Sinai and you want to help enrolling in Medicare, call the Cedars-Sinai eHealth line at 844-296-6098 for more information. And I know we've said it a couple times on the call, so hopefully you can remember it by now. And we'll be sharing more resources in our chat. So I saw a couple comments. If we didn't get to your question, we will share more resources in the chat. And we always have more follow-up content on blackdoctor.org. Shameless plug, there's mine. And so thank you all again so much for joining me. Thank you to our audience for tuning in and engaging with us. And we hope to see you soon. Thank you all so much.
Thank you.
Thank you.
Yeah.
Bye.